Can genetics improve antipsychotic medication for schizophrenia? Imagine if your genes could help doctors pick the best medicine for you. That's what researchers are exploring when it comes to treating schizophrenia with antipsychotic medications. These drugs are the main way to manage symptoms like hallucinations and delusions, but they don't work the same for everyone. Some people get great relief, while others experience little benefit or tough side effects. This inconsistency has made scientists wonder if understanding a person's genetic makeup could make treatment more effective and safer. At the core, genetics influence how your body handles medications. Enzymes in the liver, especially those in the cytochrome P450 family, break down antipsychotic drugs. Your genes determine how active these enzymes are. For example, some people have genetic variants that make them poor metabolizers, meaning their bodies process drugs slowly. This can cause higher drug levels in the blood and more side effects. Others are ultra-rapid metabolizers, clearing the medication too quickly, which might make the drugs less effective. Knowing your genetic profile could help doctors decide on the right drug and dose, reducing side effects and improving how well the medication works. Genetics also affect how antipsychotics interact with your brain. Variations in genes related to dopamine, serotonin, and other neurotransmitters can influence how a drug relieves symptoms. For instance, the COMT gene affects dopamine levels in the brain's frontal cortex. Different versions of this gene might change how someone responds to treatment, especially for negative symptoms like lack of motivation. Genes involved in serotonin signaling, such as those coding for serotonin receptors and transporters, can also impact medication response. Another factor involves drug transport proteins like P-glycoprotein. These proteins help move drugs in and out of the brain. Genetic differences in these transporters might influence how much medication reaches the brain, which can affect both benefits and side effects. However, it's important to remember that genetics is just one piece of the puzzle. Other things like other medications, diet, and overall health can change how genes influence drug metabolism. This is called phenoconversion. So even if you have genetic testing, doctors still need to look at the whole picture when choosing treatment. Today, pharmacogenetic testing is becoming more available. These tests look for specific gene variants related to drug metabolism and response. Some focus on the cytochrome P450 enzymes, while others examine a broader set of genes. Early studies suggest that using genetic information to guide treatment could help find the right medication faster, with fewer side effects. But these tests are not yet standard everywhere, and more research is needed to confirm how much they improve outcomes. The hope is that in the future, genetic data will help doctors personalize treatment plans. Instead of a trial-and-error approach, they could predict which antipsychotic will work best for each person and at what dose. This could mean fewer side effects, better symptom control, and a quicker path to stability. In the end, genetics holds promise for improving how we treat schizophrenia with antipsychotic medications. While the science is still developing, it points toward a future where treatment is more tailored to each individual's unique genetic makeup.